on SSW20?
Yes, but I don't think I can answer. Would it impact on services when they are discharged? I'm pretty sure it will.
Yeah. Do you want to come back on that, Andrew or Claire? Because either of you? Sorry.
Yeah, I don't think that's one that I could comment on.
Did you not comment? Sorry, my apologies. Was it yourself? I can't remember. So SSW20, wasn't it? It's
yeah, on discharge, so will they require support really? And obviously, is that an impact on services?
Well, what Jackie was highlighting was that this particular caseworker supports discharges of people who, at this point, don't require social services assessment. And what she was highlighting was that there was a risk if those discharges are delayed, that needs will escalate as they do when people are in hospital because they're off their feet and not mobilising and living as independently. There's a risk that needs would escalate, and we'll see more people require assessments. We can't say definitively that would happen. Equally, we can't say definitively that it wouldn't, but that is the risk if this worker isn't in place and supporting those discharges, that more people would be delayed in a hospital setting.
Thank you. Does that answer that? Yep, lovely. Councillor Williams, can I bring you in, please?
Thank you, Chair. First of all, my camera has died so that it's actually switched on, but you probably can't see me unless you can. I don't know.
No, we can see you, but don't worry, we're having lots of problems with IT, so don't worry if the camera goes off.
That's it, yes, okay. The question under SSW20, it relates to would this £35,000 reduction for caseworker resource impact on vulnerable people at their time of greatest need in hospital? That's the question.
Thank you. I think that's very similar to one we've just had, but Claire, if you'd like to answer.
Yeah, in summary, yes, it could impact. You know, this caseworker will have a caseload of people who are being supported at the moment. If that support isn't available, it could result in delays in those people being discharged from hospital. It could result in some people's needs increasing and requiring social care assessments. So yes, it could impact on vulnerable people.
Thank you. Does that answer the question?
Yes, it does actually, and it's a bit of a worry actually. But thank you very much.
Thank you. I think supplementary to that as well, is there any possibility of reassessing this at all on that budget line? Would that be something that you would be amenable to?
Yes. Oh, are you talking to?
Well, my understanding is, Chair, that when we finish today, you'll come up with some recommendations or some suggestions with regards to what you've heard today. I think that we will collate all of those then and re-go through the budget as a result, taking those into account. So if it is something that you want to raise, I suggest you do it through your recommendations at the end of the meeting, and they will be picked up.
Thank you. I'll catch that tennis ball that you've just thrown back to me. I'll pop it in my pocket. Thank you. It's already on my notes, but thank you. Right, lovely. So if we're all content with that, moving forward, SSW21, please. And this one is for myself. So I've got down, obviously we've gone through the others, and this one is a green, and I just wondered if there was a reason why all of the others were red and this one's a green. Is there a reason for that? And is it because conversations have been had and this service is one that's going forward and it's green as opposed to red? Is that what the answer is? I don't know. Thank you.
The management fee that we have, I think I referenced earlier, we've been working with Halo to reduce that on an annual basis based on finding other ways of funding premises investments. So that funding is not even something that we will need Halo's agreement with, and it will not impact on Halo. The other items that are not in the green or other category are still to go through the final stages of discussion and agreement.
Thank you.
But we can confirm that is deliverable next year.
Thank you. That's perfect, and that's what I was going to ask, if you can confirm. But no, that's great. Thank you. SSW 22 and Councillor Harrison, please.
Thank you. Just get this up on screen. No new referrals. Where would referrals come from? I'm a bit ignorant on that one. So if this is the case, why is it amber? What's the risk? Could we have an explanation on that, please?
Thank you. Who would like to take that, Claire?
Yeah, this is one with Jackie having left that I probably need to come back to you on, Councillor Harrison. So if I can take that away and get an answer.
Certainly. Thank you.
Thank you for that. Moving on, my apologies. I am at SSW 23, and just very quickly, I want to know if this is a sustainable cut going forwards, please. I know it's on green, but yeah, Claire.
Yeah, our risk assessment is that it is, which is why we've risk assessed it as green, and that's because we've looked at the rebate that we've had from the regional adoption services over the last 5 years. All but 1 year, they've been significantly in excess of the amount that we've put forward. And even if we did have activity which was above that funding which we put in, then we could spot purchase that and it'd still be more cost effective than putting the money in and getting it out from a budget perspective. And it would also be more cost effective because we've been moving children on from foster placements as well. So we're content that this is a low risk saving.
Lovely, thank you very much. Moving on to 24, SS24, and I've got Councillor Watham here, please. SSW 24, about the training reductions.
I got so many notes, is that true? Yes, a quick question in relation to this issue of this item. Why has in-house training not been done before? It would appear that other directorates have gone down this avenue.
There is in-house training, Councillor Wathen. We've got a large number of registered staff in the directorate, and we're also responsible for training staff who are employed by independent sector employers as well. So we've got a wide range of responsibilities for the care workforce in the county borough. So we do deliver a combination of commissioned and in-house delivered from the workforce within the teams. This would balance further towards the in-house delivery, so the workforce within the teams. The reason you access external trainers is because they bring in expertise that you've not got readily available in-house, but in the current budgetary situation, that's something that clearly we're having to review, and it might mean a slightly less optimal training offer, to be frank, but it is affordable and deliverable within the context we're operating in.
Thank you. Does that answer your question for you, Councillor Watham?
Yes, many thanks for that.
No problem. Just as a supplementary to that, obviously, if we're looking at suboptimal options here, then would that not be on a different RAG status? Would it be on an amber?
I think we've got a lot of ambers and reds. So we're trying to look at some things which were easier to deliver. We're also, one of the other things that we've been doing, and it does present a lot of challenge to us, is, reduce our use of external venues. So there was a time when we were using, certain venues in the county borough quite a lot. We're using in-house far more. It's not easy because, some local authorities will have facilities that can be readily used for training, and we don't as a county borough. So for example, delivering training in the council chamber is not the best setting, is it? But in this context, again, that we're operating in financially, that's another part of that saving as well. So we're doing everything we can to mitigate that, but and we do, as I say, because we've got a registered workforce, there is training which is absolutely mandatory to their ongoing registration that we have to support. So it does mean some of the nice to haves aren't going to happen, but that's the same across the whole of the authority, isn't it?
Thank you. Councillor Gebber, did you want to come in on that?
In other local authorities, they have training suites. Bridgend don't have one. And whilst I would agree that we need to try and use in-house cheaper venues as possible, There are times for social services staff when you consider the amount of social services staff. You can't get them all in one room. And, you know, we have had some training events that I could fill this chamber twice over because of the amount of social work and social work staff that we have in them. So we are cognizant of that, and we are always looking for cheaper alternatives now, particularly considering the budget position we're in.
Thank you. I know I might be saying something completely ridiculous here, but just as a thought, we've obviously heard earlier that we've got the Bowls Hall that needs to be repurposed, and would that be suitable for this sort of thing as well? Because that's quite a large venue and would perhaps take that figure of number.
Yeah, exactly those sorts of things that we're looking at, Chair. So if we can use venues that are run by partners, that's part of what we're doing at the moment. We're working with Halo in terms of the Life Centre to get best use of the space there. That will have a revenue implication, but it's a better use of public money because it's going into, as we've talked about, the social enterprise, and at a better rate than we would be paying for if we were just using the private venues.
Thank you. Right, okay, moving on from there, we are at SSW 25. I don't know if we've got Councillor, oh, my apologies, Councillor Ross Thomas, did you want to come in before, or?
Not Chair, happy on 25, but if you've got someone before me, that's absolutely fine.
Yeah, no problem. I don't know if we've got Councillor Llewellyn Hopkins back, or if Councillor Kaparos is taking questions still.
Sorry, the one she's sent me is for SSW 26. So if I'll just wait till that one. Okay.
No problem. I've got it down for 25. Councillor Ross Penhill Thomas, please.
Splendid, thank you, Chair. Yeah, I'm just a little bit concerned about this. Obviously, you can see it's RAG rated as amber. And now, given the significant challenges that we've discussed today, that the service has been through over the last 18 months to 3 years, and the inspections that we've received and the amount of money that we put in now in terms of an improvement plan, how likely is it that this potential redundancy, what's the likelihood, what's the assessment then internally that this redundancy could actually risk the compliance agenda and regulatory judgments? That's something I really don't think we would want to see, certainly not in a forthcoming social services meeting whereby we've missed something or those regulatory judgments are coming back as poor. Thanks, Chair.
So to provide some assurance, Councillor Penhill Thomas, this doesn't impact on those support worker posts that were funded as a budget pressure a couple of years ago to support the frontline teams. This is more around central support within the directorate. So we're in the process of completing a review at the moment. So it will probably impact on senior managers, dare I say, in the directorate, but not on frontline teams, and therefore shouldn't result in the regulatory judgments as set out.
Thank you. Does that answer your question?
Yeah, I can see. So it's obviously it would be remiss of us not to highlight it as a risk, but so far as risks are concerned, you're quite content that it's something that we can carry, yeah?
Yeah, and I think as well, supplementary to that, one of the questions was, do we know how many posts roughly that would be equivalent to?
It'll be 2 posts.
Thank you. Moving on to SSW 21, and I have Councillor Eugene Kaparos, please.
Yes, Chair. Are we on 26 now? Sorry, my
apologies. It's me misreading it. You're quite right. 26.
Okay, so yeah, I'll ask mine and Joanna's together then as one. Where are we now with existing cost recovery? And can you tell us what the charges will look like for residents? Are we talking about charging ancillary services, or are we subsidising the main bulk of the care cost? And if so, what sort of rises will residents expect?
Claire?
Yeah, so obviously social charges for social care services, and this is around adult social care, are capped in accordance with Welsh Government regulations, and are also means tested. So in terms of care home residents, there is a cap at £50,000. So if your capital is less than that, the local authority picks up the full cost of your care. If your capital is over that element, your contributions are means tested. One of the principles within the budget consultation that we're considering today is to move towards full cost recovery, and that's what this proposed increase enables us to do. It's an increase in, we've talked about increases of around 10% across the sort of charges that are levied by social services. I haven't got the exact charge to hand at the moment, but we'll come back to you with that. But yes, it would be an increase in that region for those residents who contribute to or pay in totality for their own care in our in-house care homes.
Thank you. Does that answer your question there, Councillor Kaparos?
Yes, thank you, Chair.
Thank you. Again, as well, can I just supplementary ask, obviously if there's an increased charge there and there's a risk, obviously with cost of living and cost of everything going up, there's a risk of default on the charges there. Are we okay for recovery and things like that, especially with cuts in the finance department staff? Is it going to put additional strains and pressures there?
I'm not sure that we're talking about taking resource out of that particular team, are we? That's not within our savings for next year. Apparently we could be. Right. But we'd have to monitor. It's going to be an issue of risk, isn't it, really, as to with the capacity that we've got, with what we're able to do. And for us, recovering any debt that's due to us would obviously be a priority for us.
Right. Thank you. Thank you for that clarity. Right, moving on to SS27, and I have Alan down for this question. Councillor Wathen, please.
Yeah, thank you, Chair. Quick question. How will this impact on Bravo? What services will they need to cut as a result of this 10% reduction to funding?
Thank you. I know we don't have any representatives from Bravo here today, but I don't know if perhaps you might be able to answer that question, Councillor Gebby.
So our service level agreement with Bravo is to support all our third sector colleagues out there in their governance, in financial contributions, making grant applications, all that sort of thing. I am aware that there's been a review by the Health Board currently, and they gave them an uplift. And they gave them an uplift because we are not paying them to contribute and engage in various other fora that we and Welsh Government, in their wisdom, keep saying that they are part of a structure, which is fine. If a CVC has to be in the RPB, the PSB, whatever, that's fine. But as an authority, if we and the Health Board, as the statutory partners, have an expectation that they should be in these meetings and should be engaging, I'm sorry. I'll refer back to my last comment, third sector provision. They are so supportive. Indeed, Bravo were recognised in Bridgend as the highest performers of third sector and volunteers during the COVID pandemic because they got our communities really connected and out there. I am concerned for obvious reasons. I'm glad that she's not in the room, actually, because I think that makes it easier. But we do have a member of staff from Bravo that sits on our council. So I couldn't answer for them. I suspect that will mean that there'll be a loss of staff in there. Thanks very much, Chair.
Thank you. And obviously that has that knock-on effect from the funding earlier, which is difficult and unpalatable, I would say. So thank you. Does that answer your question?
Yes, thank you for that.
Thank you. So as we come to the end of this, I am aware that obviously we've been told as chairs that we can take questions from other scrutiny members in different areas if they've got questions on this. So I do have a question from Councillor Amanda Williams, and I don't know if Councillor Williams is with us on the call. I saw her earlier, but I think she may have dropped from the call. So I will read out her question. Councillor Penhale-Thomas, did you have questions as well from your group?
No, just an overarching question after yours, Chair, that's fine.
No problem. So from Councillor Amanda Williams, SSW2 is the only reference I can find this under, so she's referencing where it is. However, I think it's a broader question, is this. As we heard in SOC 1 yesterday, when discussing the proposed cuts to education, children are some of our most vulnerable in the borough and must be protected. Has the Directorate looked at the cost of child residential placements? How many children do we send out of county and what does this cost? How many vacant places do we have in our county, and can savings be made in this area either by bringing more children back to our establishments or investing to save in new buildings? So I don't know, Claire, would you like to take that?
Thank you, Chair. I highlighted, I think, much earlier in the meeting that the issue of independent residential placements for children, care experienced children, they are very high cost. The average cost is about £5,500 per week, but we can have placements which are as much as £11,000 per week. So, you know, that there really is a significant cost implication attached to individual children. As per the question, they are our most vulnerable. These placements are directed by the court, so the care plan will be in place, but you know, it will be subject to legal proceedings as well. We've obviously in Bridgend developed in-house provision. You know, we've got quite a range now, and you know, we're developing a placement commissioning strategy to determine whether the increase that we've seen in the number of care experienced children going into residential is a blip or whether it's a trend, and whether that justifies us developing business cases to develop more in-house provision. So that work has progressed and is ongoing. We had a presentation at our corporate parenting board yesterday from Dan Bolton, who's the RI for the in-house provision, which showed how that's being effectively utilised, and we are bringing some children back from independent residential placements into the in-house provision. Again, has to be subject to court orders, can't be done quickly, has to be very carefully planned, but small numbers are coming into the in-house provision, and it is, you know, when those children return, it will be being utilised almost to full capacity. So there's not a slack in the system in terms of an underutilisation in-house. As I talked about earlier when we were talking about some of the budget pressures in children's, at the moment, that area is significantly overspend. It's probably, when you look at the budget monitoring reports, probably the biggest overspend position across the whole council. For the reasons that Cara said, it's not there as a pressure, because over time we anticipate through all the actions in the children's strategic plan that we should be able to reduce those numbers, not quickly for all the reasons I've said, but safely and over the period of plan over the period of time of that plan. And we need to model that from a financial and from a service perspective. So in terms of savings that you could include in a budget, given the level of overspend, I would suggest, and Caris might want to come in, that wouldn't give you a balanced budget, because you are, you know, as a council, we are so overspent in that area at the moment. But there are plans, some of which have already been delivered and others coming together, about the remodelling of that, and I'm very happy to bring that into a future scrutiny committee, given the level of risk that particular budget area presents to the authority.
So in terms of that, and obviously balancing the budget, because it is quite a significant overspend, are we in fact, I'm just thinking how to put this correctly. Yes, I know you would, and I would ordinarily. Are we putting finance before the welfare of children in this instance? And is that correct for us to do?
Very definitely not. In fact, one of the comments, and I was going to make a contribution on this point, and that is, if we identify that the best placement for a young person is costing us £1 million a year, I don't care. If that's the best placement for our young person, that has to be. And I'm not suggesting for 1 minute that we're going to spend £1 million on a placement for a child. What I am saying, though, cost should not be the indicator or any deciding factor when we are dealing with our most vulnerable children. We will always do what's right for them, because that's the way we practice. Thanks, Chair.
Thank you. Just on that, I will come back to you, Claire. Just on that, because I mean, there are very specific questions that Councillor Williams has asked, and one of them is, how many children do we send out of county, and what does this cost? So I know you're saying if it costs £1 million, it doesn't. I know it doesn't, but do we have an indicative?
So, from memory.
I got you.
Oh, there we are.
Oh, There we go.
Yeah, so we've currently got 19 independent residential placements. Now we've got more children than that who are out of county because the number of foster placements are out of county. There's a number of children who live with connected family members who don't live in Bridgend County Borough. But if the crux of the question is around residential, we've got 19 independent residential placements. Some of those will be in the county borough, some of them out of county. But if the underlying the question is the cost of those placements, that is still quite low in the Welsh context. It's higher than we've been for many years in Bridgend, but it is still quite low when we look at other authorities across Wales, and this is a massive issue for all local authorities, I would suggest. In addition to that, we've got at the moment 3 placements where they're operating without registration, and those are our most expensive ones because those placements carry a much higher degree of risk because they're not registered, and therefore in terms of staffing numbers, which drives these costs, it is higher. We monitor this very closely. As I said, we've got the plans that I talked about in place, but those are the numbers as at today.
So I think as well, sorry, I hate to labour this point. I think the question was how many out of county, because I think you've just said the 19 is a mix, is it? Is that correct?
Yes, it is a risk. We'll get the exact figure of those from in county and out of county. The reason I was talking about the independent residential is because that's where the costs are driven. The in and the out of county is less relevant for cost, but we'll get that exact. And I say in terms of the total number of children who are care experienced who don't live in the county borough, that'll be a different figure again, because that will include the independent foster agencies and connected persons, carers who are outside of the county borough as well.
Yeah. And just finally as well, because I know coming down to the final question here that Councillor Williams asked, it was how many vacant places do we have in our county, and can savings be made in this area either by bringing more children back in to the establishments or investing in new buildings? Is that actually a possibility for new buildings?
Yeah, that's the purpose of the placement commissioning strategy that I referred to, is to take that detailed needs analysis. And as I say, we've seen an increase, but we need to be very clear whether that increase is a permanent increase in the numbers requiring residential, or whether it's a blip for want of sufficiency of foster placements, for example. And if there is a business case coming out of that to develop more, then we will work with Caris. Obviously the capital from a council perspective is very challenging. We can apply for regional capital, as we did in the development of the new assessment unit. In terms of vacancies in-house, the longer term residential home that we have will be full in the next month or so. There's 2 children who are returning from other placements to go into that. There's a fluid turnover in terms of the assessment unit, the new one, and that's exactly the way it should be. And I'm sure we're already demonstrating cost avoidance from that, because we've got children who are going in for a couple of nights and then returning home, whereas if they went into a independent residential placement, it might take months, even years, to get them back home. So that is working well at the moment. There's probably place for one more child in the 12-month provision in that home. The longer term home for children with disabilities can't take any more children at the moment, and we've also got our respite home and our pop-up home, both of which are to capacity in terms of the numbers going through those provisions.
Thank you. And just finally, before I finish, I mean, obviously, it's not a magic wand scenario, and if it were, it would be absolutely wonderful, because we could wave that wand and we would have whatever we wanted. But obviously, we are looking at provision here that is coming to capacity. What are we putting in place for future mitigations? Are we actually able to sustain that going forward? Is there any plans going forward for new residential facilities, things like that, just for the public? Thank you.
Sorry.
Sorry, I don't mind. Do you want to go, Councillor Gabby?
I think it's just we need to review and look and assess before we decide and determine that we need to invest to save in more properties in Bridgend. I don't want to come to this committee and say, right, look at this. This is the past year, because you know I can all be quite passionate when I'm in this chamber. That's fine. What I would say is that we need to review it and assess it before we make that determination, because our numbers are such that we've never seen them like this before. I want them to go back down. So I would prefer to have them back down and not be building any more provision. However, I suspect that there will be a couple that we will need of single homes. And that's because of the complexity of the children that we are dealing with.
Thank you. Claire, did you want to come back in?
Yeah, only very briefly to say, this can't just be about residential. So, we talk a lot in the chamber about foster carers. We can see that in some of those children that come into residential, it is for the want of the right skilled foster carer available at the right time in order for them to be living with a foster family, and that is invariably a better outcome. So when you see the plan that we're quite advanced in terms of developing around the future commissioning that we need to do, it will pick up that aspect as well as the residential, because as Councillor Gebby has said, the risk is we just keep building more and more, and if you build the beds, they will be filled. They absolutely will. So we've got to get that needs analysis right.
Thank you. And just finally, before I come back to my two very patient councillors that are waiting, we do have Councillor Williams in the chamber. I don't know if you want to add anything to this in your capacity as Cabinet Member for Finance.
Yeah, I think the point that's been made by the director are very valid. We do just need to understand what the long-term situation is going to look like, and we can't have a knee-jerk reaction for this. We just got to be patient and understand, and get the system right, and then we'll act accordingly.
Thank you for that comment. Right then, moving on to Councillor Penhale-Thomas, please.
Thanks very much, Chair. Can I just first of all thank officers and Cabinet members for their contributions today. Another marathon meeting coming to a conclusion. This is very clearly a budget with immense challenges. It's a budget of priorities and of cuts. And in that light, Chair, and recognising that we are just about to conclude and go into recommendations, I'd like to push the Director and the Cabinet member throughout these 27 proposals. Were we to be of a mind, certainly as a committee, but as a council, and I bear in mind the ongoing negotiations between Welsh Government and UK Government of potentially having teachers' pay and pensions provided for, were there to be excess, limited though it would be, excess funds, are there any particular areas that they would like us to focus on? And I would like to push, because this is a budget of priorities, and unfortunately we all have to make difficult decisions. So I would welcome that clarity. Thank you.
Thank you. I think I'll bring Councillor Gebby in, and perhaps Councillor Williams as well, if you like.
I want to say all of them. However, I know that my Cabinet Member for Finance sitting behind me is probably cringing in his seat as I said that. Yes. For me, that there are things that are going to take some time, and we will save money long term for it. I don't want to be precious. I think that we have given you, and we've been very honest in our assessment of what we believe the RAG status of each individual proposal is. We need to protect our children, and I want to protect early intervention and prevention in all manners, at all ages, for me. If I can do that, irrespective of what's happening in the longer term in statutory services, actually the demand coming through to statutory services is going to be so significantly less. And when we look at all our research data, if you look at anything like that, it will tell you the same as I'm saying now. And that's what I think we need to concentrate on more than anything else. Thank you, Chair.
Thank you. Councillor Williams, do you want to come in?
Thank you, Chair. Obviously, I'm trying to sit through all of these meetings and to get a genuine feedback of the concerns and the pressures, because we've got to build that in. And I've always said that council tax is the balancing figure. We will make sure that we get the risk as near as we possibly can, and whatever risk we have to carry, that's fine, but then council tax will have to pick up that balance. Now, I sat through education yesterday, I've been through part of this today, and at the moment our council tax rate is going to be exceedingly high if we, address all the concerns then. And so we have to risk that balance. I'm also acutely aware that next year is going to be far more challenging and difficult than this year. Far more challenging because the announcement from Welsh Government is, we had 7.5 million extra RSG this year. Next year, we're likely to get flat cash. Next year is going to be extremely challenging. And so we have to balance all these risks up. I'm absolutely getting that there will be a tipping point, and I think Councillor Ross Penhill-Thomas made a very good point there. There will be a tipping point where some of these services will just go over the top and there'll be no return. And we have to really assess that risk, and we got to understand the implications of what we're doing. But at the back of my mind is always that there are authorities that have run out of cash, and commissioners come in, and out the door goes any empathy or any sort of, it is cold-hearted decision making, and all these concerns that have been very genuinely made here today. That will not be the case for a commissioner. So it is really important that we get that balance right between the amount of risk that we put into the budget, and then also the ability, I suppose, for the council taxpayer to sustainably pay their council tax. There's no point putting it at a level where our collection rates start to drop. So that is the challenge that we have got, I suppose, as an authority, is to have a sustainable budget going forward, that we can meet the risks that are facing us in looking after the most vulnerable, and it's not an easy task. And I certainly welcome the recommendations that come back from this committee. Thank you.
Thank you. And you're quite right as well. The one thing we do not want, and having seen it with others, is the Section 114. We absolutely do not want to see that. But equally as well, I think we are getting closer and closer to the point where budgets are so stretched they will not balance, and that is a genuine concern across the board. So yes, I quite agree with what you've said. It is difficult, and I imagine it's going to get harder, much harder. However, having sat through now 18 months worth of listening to scrutiny on this panel, I do think that actually Councillor Gebby and Claire Marchant have worked exceedingly hard to mitigate those risks, and I applaud the work that they've put in, because we have come from a situation whereby we have been highly criticised for our workings and what's been going on, and we have had to move, and it's a seismic shift, to change our culture, change our practices, and we are now in a position where we benchmark, we set the standard for other councils, and it has come at a cost. But equally as well, I think that's a cost that is good for our residents, because it puts us far and above other councils for social services, whereby potentially they may not be getting the same value from their authorities. So I would like to take my hat off to you both, because you have worked exceedingly hard on that in what has been, as you say, very challenging times. So thank you for that. Councillor Penhill-Thomas, I can see that Councillor Farr is wanting to come in. Do you want to come in on this, Councillor Farr?
Yeah, it was just like the question Councillor Thomas asked, really. I mean, it's like what Councillor Gebby have said. If you look at the line that we've looked at today, majority of the budget cut proposal are under well-being, which helps to prevent people coming into social services. So yes, if I had a choice, I wouldn't want to cut anything to do with well-being, funding to the third sector or community centres. But as a whole, as a council, we have to make these tough decisions. So yeah, Councillor Thomas, I wouldn't want to take anything off, any of those things we've proposed, but we don't have a choice. We've got to make these tough decisions. Thank you, Chair.
Thank you. Councillor Penhale-Thomas, are you content with that? Fabulous. Councillor Aspie.
Oh, thank you, Chair. It's just an observation in regards to adult social services. Are social services aware of the potential financial impact and burden that housing department could be having within their budget? And I just want to sort of expand on that a bit further. If somebody who has a support network within their local community is then being requested, if they found a property or flat, whatever it might be, 10 miles away, they were living completely independently of the authority with no financial burden whatsoever. And all of a sudden then the social services then have to spend additional money from when they shouldn't be doing. So what I'm saying is that if there is a financial impact on social services as a result of housing policy, shouldn't that be undertaken prior to them being located to another part of the borough? Thank you.
Thank you. Do you want to come in on that, Claire?
Yeah, I mean, all I can say is that Caris and I and Martin and Jackie work very closely together on this. I think probably the social services risks and the housing risks in the county borough sit alongside each other in terms of corporate risk assessments and the challenge that they face. So we're in a very, I would say, less than optimal position on both. There is the new homelessness and housing strategy, and you know, we've got working groups beneath the work that we're doing to work together on this. We wish that we could magic up different solutions. There are new things such as the HMOs which are coming forward in terms of that. So we are working very closely together to mitigate these risks. But yes, they are significant risks and issues in terms of supply of housing and how that joins up with care and sometimes housing being in the wrong place for where people's local connections are. So significant issues, but we work together as one council on them.
Thank you. Does that answer the question for you, Councillor Aspie?
Yes, it does. It's just that in the past, I know that departments haven't been very good to speak to each other. They tend to work independently. So that's my main thing, is that they're actually talking together and actually realising the assessment and risk and financial burden.
Yeah, I think it's good to hear that that is actually happening now. So yes, thank you very much. Just finally, Caris, I mean, obviously we've heard about the dire warnings of Section 114, and we absolutely do not want to stray into that area whatsoever, because it will take away a lot of our controls of what we can do independently. I just wondered if you had any comment about this budget going forward, and if you are content with it as well. Thank you.
I think I said when we started this meeting, didn't I, that this has been, I think, the most challenging year I can remember with regards to setting this budget. And that's because we've got the cumulative effect of pressures coming forward from last year into this year, and then rolling forward into next year. And that's from a cost basis, and then this rolling pressure of increased demand, all of it very legitimate, and all of it that we need to deal with. I think I've also said at one of the other scrutiny committees this week that we're carrying more risk in that budget than we probably have done in the past. And there's work that we need to do to make sure that, first of all, you know, these savings are deliverable. And there's also work to do that when the budget is set at the beginning of March, that we have very good monitoring processes in place. One, to pick up two things, really. Importantly, from a financial point of view, if things are not going as planned, we can take remedial action as soon as possible, but also very importantly, to manage the impact of that through the services as well. And I think I said at that committee, and I'd repeat it today, it is about the services and finance working very closely together earlier on, so that we can come up with solutions that actually make sure we don't put people under more risk, make them more vulnerable, but support them as much as we can. But very wary that there's a very fixed financial envelope that we've got in order to do that, really.
Thank you. Yes, and that is entirely my concern as well, that actually we have to balance that service that we have to provide to some of our most vulnerable in the borough, because those are the people that actually require social services. And then obviously the funding that comes with that, is it sufficient? I'm aware that obviously we went significantly over budget very quickly last time, having set what was a robust and legal sufficient budget. Are you holding concerns again this time that that might be replicated once again, because obviously we're hearing that there are significant pressures, and we know going forward we're hearing that, you know, future years are going to be just as bad, if not worse. So are you concerned for our quarter outturns as well, where we stand from now? Thank you.
I think this year we've got significant in-year pressures, as you've said. Some of those around still the peaks in inflation that we couldn't have known about when we set the budget. And that's impacted on a lot of our costs, including our pay costs. And I think Councillor Gebbie has already commented, if it wasn't in this meeting, you've certainly said it this week, in one of the many meetings we've sat in, is about just the size of the workforce. And actually many of our services are, the majority of their budgets are about paying our staff, really. So increases in pay as well at levels that were not, you know, we set this year's budget 12 months ago. There's been a lot of change and the economy has changed a lot since then. We've learned some things from that, so we have looked very closely at the provisions that we're putting in around pay awards and around inflation going forward to try and ensure the robustness of this budget. But I am also conscious that there are still a lot of things external to this authority that can come in and impact on us and have a financial impact on us. And I think it does come back to us then working all very closely around managing expectations once the budget is set. And I would say that from an officer point of view and from a member point of view as well, really, with regards to what we have in that budget and what we're actually able to deliver within that boundary.
Thank you. That's a very clear roundup there, so thank you. And it's an honest assessment as well, so I appreciate that. Thank you very much. So if councillors are content and if there are no further questions, which I don't believe there are, can I thank our invitees and certainly, you know, can I thank our officers as well who've worked exceedingly hard, as well as our cabinet members. But it's very much appreciated, and you may leave. Thank you. Leave us to the recommendations.
Thank you, Chair.
Yes, members, can you remain as well, please, whilst we just finish up? Sorry, members, I'll just wait whilst we've cleared the chamber here. Thank you. Right, thank you for your patience. I'll move us on to item 5, to conclusions and recommendations. And could our scrutiny officer summarise the key points and the committee make its conclusions and recommendations accordingly, please? Thank you.
Okay, thank you, Chair. Obviously, the meeting has been now a significant period of time, and we've covered every single point on the report for social services, Chair. So I don't intend to go through them all. I think perhaps if members wish to make recommendations on particular points, they could recommend them and we'll take them at the end now. I think there were some key discussions on the halo items and the third sector, sorry, I lost my words, third sector, and there was some discussion about if there are limited extra funds from the better settlement and maybe the teachers' pensions and maybe the final settlement, if there were any particular budget lines that you felt needed to be looked at again and considered, or if there are a number of them that you wish to maybe spread around any reductions. So maybe talk about that and see what members think.
Thank you. Yes, I agree. We've obviously got some potential pots of money to come back. They're not massive, obviously, when we're talking about the pensions, etc., and the settlements. So I don't know if any councillors would like, any members would like to make recommendations. Councillor Kaparos?
Yes, thank you, Chair. Only one in particular, and that was about SSW 16. I think it's a small pot of money for the reasons we've already covered. If we do make a recommendation on it, I would like to recommend that we don't cut that particular line.
I quite agree. I've got notes down here as well because obviously we heard from the cabinet member that she would like to hear alternatives. But I think one of the recommendations would be for SSW 16, but equally as well SSW 20. I think if we make a recommendation for the both of them to be looked at, but certainly absolutely 100% SSW 16, because they're relatively small sums. I haven't got them in front of me. I believe off the top of my head it was 16 was 30,000 and 20 was 35. So in the grand scheme of things, it's not a massive sum of money, but they do have a massive impact. So I'm quite content with that, if members are content with that as a recommendation, that it's thrown back for a reassessment and the cut is reassessed. Councillor Watham?
Yes, thank you, Chair. I just got some concerns. I did bring it up and it wasn't debated on page 61 about reviews. The word was used a lot. And well, my question is, are these reviews still under consideration going forward? So if they are, they shouldn't be in the budget, basically. So I don't know if that is a reasonable recommendation or a question to be asked elsewhere.
Chair, I don't think my mic's come on. I don't know if everyone can see me, can they? No?
No, I think we can see you.
Oh, that's okay.
Yeah.
I was just going to say, I think Andrew Thomas and the director and the cabinet member spoke about this, and I think what they're saying was the one budget line that was green could already be put in place, but the reason that they were red was because they're part of a contract. They still have to work that out with Halo, so that the risk is red at the moment. It's not to say it would be red in April, but by the time we get to when the cuts need to be made. But I'll defer to you, Chair.
Thank you, Meryl. I think as well part of the question was around the fact that a lot of these were review rather than firm and sure on the budget lines.
Well, my question is, are these reviews completed?
Yes.
So they should be included, but if they're still under review, they shouldn't be included. They're still being looked at, aren't they?
Absolutely. And I think there was clarity required on the budget for SSW 11, I think it was, with the 1.27 million. And we were told that it was part of the 1.399. So potentially there wasn't that clarity there. So I think perhaps the recommendation could be that we have clarity, seek clarity as to what is under review, what is, actually a budget line, because you're quite right, if it's under review, can it be a budget line? But also as well, the clarification on that line, because there seemed to be quite a lot of confusion in this budget, and we do need that surety, we do need that certainty that we know what is going forward in this budget as potentials at this point. It is only potentials, that is the point. However, we do need that surety because it has been worked on for quite some time now. So going forward, I think if members are content to seek that clarification as well as a recommendation, I'm content for that if everyone's all right. Yeah. Okay. Anyone?
Is that just for all of the Halo ones then?
Yeah, I think it was across the board as well, because even outside of the Halo ones, there was a lot of reviews, recommendations, that sort of language, and we need to firm that up. But certainly on the SSW 11, there needed that clarity. I don't know if anybody else had anything else to add to this.
Just to clarify as well, Chair, there were a number of pieces of information that couldn't be provided, and we will sweep up and get those for you and circulate them. So.
Yeah, absolutely. I think as well. Councillor Thomas, go on.
Thanks, Chair. Yeah, just linking in strategically, I guess, with your chair colleagues in SOC 1 and SOC 3. There is continual mention of grant funding, the issues it causes, particularly in education in this directorate, most likely as well in communities. And there just appears to be, I don't know what it is, a lack of recognition of the need for certainty, really. We cannot continue to set budgets with so much relying on grant funding. which then ends in year 2 and year 3, because you just don't have the stability to continue providing those services. So I really think a very clear message needs to be sent to Welsh Government around that, that in particular. Whether you can link in with your chair colleagues, I think that would be useful.
Yes, that was one of the notes I've got down here, actually, because I know that Councillor Gebbie said that there was a lot of correspondence that she'd had with Welsh Government around social services funding, and she said that she was happy to share that. So I was going to ask if we could possibly see that conversation that's been had around that, and if possible, if required, I'm quite happy as the chair to support on those issues that have been raised at the Senedd, and to press home that actually grant funding, you're quite right, we are not able to have that surety going forwards for setting budgets if grant funding is being pulled or running out or whatever it is. You know, we need to have that surety. So I'm quite happy to do a recommendation around that if you wish. Yeah, fantastic. Anyone else got anything? I think one of the other recommendations, and I think it might be a difficult one, is no, I'll start with the easy one. Sorry, I've got two actually that are suggestions. SSW 10 suggestions for perhaps clubs and town and community councils to look more at catting, and for BCBC to take these across to cats, and that would obviously bring an alleviation of those pressures in for BCBC. So I don't know if members want to suggest that cats are looked at much more than they currently are for this. Councillor Watham, do you want to come in on this?
Yeah, I was just going to point out they take such a long time. As you know, up in Coediaya, we've been in conversations and negotiations with BCBC for about 18 months now in relation to the community centre, which has been shut for 3 years. I would anticipate eventually it'll happen, but it's going to take another 18 months or so.
Absolutely. And I mean, this is part and parcel of the problem, isn't it? Because we're cutting staff as well. I mean, I believe there's one member of staff for cats, isn't there, for the whole of the borough? So, you know, we're already at one staff member, and that's overloaded, is that post. So would we have difficulty with this going forward as well? Because it's clear that we're not able to do that in a timely manner at the moment. So I don't know if members want to make a recommendation on that or feel it will be futile.
It's certainly a useful programme, but it takes so long, and how it would affect budgets. It won't, will it? Because it's so advanced in the future, to be perfectly honest.
Yeah, that's fine. I'm quite content to leave that then if members are. And then the other one is based on the back of Councillor Williams's questions, and it's a suggestion that may not go down well because it's a difficult one. Is bring the children home from out of county, because it does cost a significant sum of money for us to have children out of county, and where possible we should be planning to bring those children back ASAP, because that massively reduces the budget. It's a significant portion, so I don't know how members feel about that.
I think there was, I think they were open to it, but it was just about you couldn't do it without a court order to put it in place, changing the placement, could you? So
yeah, I think, Chair, it's a very complex situation because these children are out of the area because of various situations which probably fall under legal obligations. So it's a difficult one, honestly.
I think as well, a portion of them are because some of them have to be separated from their families for various reasons. But I think where the portion of them are out of county because of sufficiency here, we need to look at that sufficiency and we need to start planning to bring those back. Because certainly it has that knock-on effect. I think, Councillor Kaparos, you raised the issue of travelling over to Bristol with children there, and that whole, and we heard from Dave that actually that's about children being out of county, and you know we have to keep those connections going, there's familial connections there, and that does impact on top of the cost of actually the child being in that care facility. There's all the supplementaries that go around it as well. So I think there's perhaps a good argument to look at that if members are content.
Yeah, I was just going to flag up as well that we were told that we could get the out of county figures. Claire had some of the information with her today, so we can get that to you. I don't know if you want to see that before you make your recommendation. Obviously, we've got the opportunity in COSC as well to finalise recommendations. So just to say that, really.
Yeah, I think that would be wise. Certainly, if members are content with that. Councillor Hughes.
Hi, yeah, agree with all that. I think they did say during the meeting, didn't they, that was the area that was the highest cost, and that they were looking at working on that. So I think we do need to say as a committee that that needs to be a priority. And obviously, it's difficult and it's very complex, and it's something that isn't going to happen overnight. But I think it's to meet the needs in 2 or 3 years' time. I do understand it's difficult, and they did explain that was an area that really needed to be worked on. But I think we just need to ask that's a priority, and this is the highest cost spend for children's services.
Yeah, I agree. I think as well they've got the plan in place, aren't they? They're working on the plan at the moment. We were told. So moving forward, I think you're right. I think we should support the plan where it is reducing this cost, and then I can't think of the word. Sorry, my apologies. Yes, prioritise. So we've got to emphasise that priority as well. I think.
Yeah.
Is what I'm looking for. Yes. So if members are content with that, we can put that forward as a recommendation for the emphasisation. Lovely. Anything else anyone would like to bring up? No. If not, then are you content as well? I shall move us to item 6 with the urgent items. And there are no urgent items of business in respect of which notice has been given in accordance with Part 4, Paragraph 4 of the Council's procedure rules. So I'm going to call this meeting to a close, and I'm going to thank you all very much, because it's been a difficult meeting with some difficult conversations. But thank you for your patience and for your input as well, councillors. Much appreciated.
Thank you.
Thank you.
Chair. Thanks very much.
Diolch.
Thanks. Bye all.